LA County officials plan to slowly reopen things up and move through the 5 stages as part of their roadmap to recovery.
So here's what it looks like. Stage 1 began with the stay-at-home orders. We're now in stage 2. But remember, there are stages of stage 2. Low-risk businesses have reopened. Stage 3, 4, and 5 still to be determined. So what will that look like from the healthcare point of view? Chief Medical Officer with Dignity Health Southern California, Dr. Nicholas Testa, always a wonderful guest with us. He is here now to answer some questions. First off, good morning to you, Dr. Testa.
Good morning, Philip.
Now the question, have we flattened the curve in LA County, and can we even know that at this point?
Yeah, so we can know it for today, and I think the people of Los Angeles should be really proud of what they've done. The stay-at-home has not been easy, but I believe we have flattened the curve. If you look at what we've seen in Los Angeles County, we're still seeing cases, right? 500 to 1,500 a day. That's not what they're seeing or saw in New York. New York was seeing 5,000 to 6,000 a day. Now, New York is beyond that, but we're still seeing 500 to 1,500 a day because that curve got flat. Now, when it gets flat, what it means is it's going to last a little bit longer, okay? So, we are managing our volume, and we have this whole time without seeing that really crushing surge of patients.
Yeah. What do you think of the 5-stage reopening plan? What are your thoughts?
I think it gives us a tool for everybody to be able to connect to, personally as well as professionally and in businesses. So we as of May 8th started stage 2. So we've opened up the low risk businesses. Within, as Philip pointed out, within stage 2, there's going to be a bunch of other stages as we open up other low risk businesses. I think the most critical stage is going to be stage 3 when we reopen schools. Schools have notoriously been areas where we've seen infection spread. If we can safely reopen schools, and not have to go back into the stay-at-home order, not close them down quickly because we're seeing the infection spread, then I think we're going to move to stage 4 and stage 5 more rapidly.
Wow.
Okay, let me be negative ninny. We have a county of 10 million people. I know that we, for now, have flattened the curve. We don't have a vaccine. Is it possible we've simply postponed a horrible spike? If people don't do this the right way, we could still surge and have something bad happen until we get a vaccine and a better treatment option.
Philip, you're so negative. Let's be optimistic here. Think about all the things that we've learned in the last 3 months. When we look at hospitals, what we do now is we really run 2 hospitals simultaneously. We run a COVID hospital and a non-COVID hospital. So any COVID patient's going to go to our COVID unit. Our providers have the PPE now that they need. They have an understanding of the disease, and we're able to manage it in a much different way than we did 3 months ago. Now, if we look at our society, we're all able to manage it differently. We're never going to be not standing in line 6 feet apart, at least for a while. And we're going to always be in this sort of push and pull of, is the outbreak getting worse or are we maintaining? And then we as a society, particularly in Los Angeles County, who's just done an amazing job of managing this, are going to decide what things are we going to need to put into place and then what can we relax on.
You brought up a good point in your last answer. You talked about hospitals being prepared to treat non-COVID and COVID patients at the same time. I know people who are concerned, they're putting things off. They don't want to go to the hospital because they feel like they're putting themselves in jeopardy. Can you, what are your thoughts? What would you tell them?
Yeah, Giovanna, great question, because we saw this really interesting thing happen in April where our emergency departments emptied out, and it was because people didn't want to come to the ED. And that was the good and right thing, right? It gave us time to ramp up. But whenever I go to see one of my ER colleagues, we always ask the same question: where did all those appendicitis go? Where did all those heart attacks go? Right? And they were staying at home. Well, that pent-up demand needs to come back to the hospital. Okay, we're starting to do elective surgeries, right? So the people who have put off that surgery, and rightfully so, for a month, we're starting to bring those back safely to the hospital based on some very stringent gates that we put into place. We want those patients to come back to the emergency rooms. I don't want you sitting at home with your heart attack or your stroke. We have created environments that are safe for managing patients, whether you have COVID-19 or not.
And I will add to that, Dr. Testa, not to belabor the point, but I had a friend who had a procedure that needed to be done. He was required to get tested for COVID 2 or 3 days prior. Then he went. So there are a lot of procedures in place for hospitals around the city and the county.
Exactly.
So thank you very much again for joining us, Dr. Testa, and I'm sure we will talk to you again.
All right. Thanks again. Have a good weekend.